Viewers, I welcome you to the final part of our psychopharmacology. This session focuses on the final part of the drugs that you use in mental health care setting. The session focuses on the drugs used in combating seizure disorders and those used in also preventing untoward drug reactions. So this session covers anticonvulsants and anti-Parkinsonian drugs. We start with the anticonvulsant drugs. They are drugs that we use to reduce or to prevent or to reduce the severity and frequency of seizures in various types of epilepsy. The different types of anticonvulsants may act on different receptors in the brain and have different modes of action. So to be successful with these drugs depend on a number of factors, which includes accurate diagnosis, then the careful selection of the drugs, in that if you do not select the best drug for a particular seizure, you may not achieve a better therapeutic outcome. And then the critical adjustment of the dosage. The indications for anticonvulsants may include generalized tonic-clonic seizures. We can also have it used in areas where the patient has generalized myoclonic jerks and complex absence seizures, as example, the psychomotor epilepsy. We can use them also in status epilepticus as well as in infantile spasms. Let's look at some of the common anticonvulsants in use. We have Tegretol or carbamazepine, etosuximide, which is also called Zarontin, Primidone, which is misolin sodium, phenytoin, and then phenobarbital. These are drugs that we use in the management of seizure disorders or convulsions. What are your implications for serving this medication as a nurse? When serving this medication, you need to inform the patient that some of these drugs may color the urine pink to reddish brown, and ensure to administer it with meals to reduce gastrointestinal irritation. If you don't inform the patient that there may be discoloration of the urine, the patient may become upset and may not even take some of these medication again. Phenobarbital is particularly useful for grand mal epilepsy. So if you have to choose medication for patients who is having grand mal epilepsy, take no any other than phenobarbital. And again, phenytoin can be used to control grand mal seizures as well as psychomotor epilepsy and focal or Jacksonian. And sometimes it's also used in alcohol withdrawal syndrome. Now, we look at anti-Parkinsonian drugs. We normally use these drugs to control extrapyramidal manifestation, which is characteristics with treatment with the antipsychotic agent. Most of our antipsychotic agents have some extrapyramidal signs and symptoms or side effects. So in order to prevent them or abolish them altogether, we use some of these anti-Parkinsonian agents. We look at some of the types of anti-Parkinsonians that we have in use. One is benztropine, which is also called cogentin. It is taken orally or intramuscularly, sometimes intravenously. it is the most potent type of all, but it's not effective against tremor. So wherever you have tremors, these will not help. It will help in other areas rather than with tremor. We also have bepiridine, which is also used, given orally or intramuscularly, 2 milligrams. It is effective against akinesia and rigidity. It reduces salivation and seborrhea. Seborrhea is excessive oil on the skin. It may produce mood elevation, that is euphoria. So when you have to choose between other drugs for patients with akinesia and rigidity, then bepiridine will be the best drug of choice. We also have attain or trihexyphenidyl. We give it orally in dosages of 2 to 5 milligrams. It has some anticholinergic and smooth muscle relaxation effects. It is also very effective in reduction of rigidity. So when you give patients these drugs, antipsychotic drugs, and they are having this rigidity, you can rely on attain. The other drug I want us to have a look at is procyclidine, which is also given orally in the range of 5 milligrams. It controls excessive salivation and relieves rigidity. So when a patient takes drug where there's excessive salivation and rigidity, the best drug of choice is the procyclidine. Nonetheless, they also have their common side effects. For example, blurring of vision, dizziness, drowsiness, and even dryness of mouth. So how do you manage them? We have seen how to manage these extrapyramidal side effects in our other presentation. So you reduce the dosage. Sometimes with salivation, you serve hard candy for dry mouth, and then you follow other regimen that we have outlined in the previous presentation. This brings us to the end of the psychopharmacology session. Thank you very much for listening.